Kinesiology taping for scapular stabilisation. First of all, let's talk about the scapulothoracic joint. It's not an anatomical joint, but it is an articulation between the scapula and the thoracic cage at the ribs. It has a key role in shoulder stabilisation, given the large amount of ranges at the shoulder. And its role is to help centralise the socket part of the ball and socket joint at the glenohumeral joint. It impacts scapulohumeral rhythm, so it's very important, but where we have that winging or that lack of control on that scapula, then it's going to affect that range of motion. You may have heard of the term scapular winging, and that's because it can look like a wing, because what we see is that medial border of the scapula protruding through the skin, and that's on either movement or at rest. There's varying degrees of protrusion. Most commonly I'll see the medial inferior corner of the scapula lift up maybe to the first third of that medial border, but sometimes, as in this picture, it can appear that the whole medial border is winging or visual. The degree to which it protrudes also impacts the movement. To any degree, it's going to have an impact on that scapulohumeral rhythm, that ball and socket that we talked about. And there are many reasons as to why it happens. Sometimes it's more serious. It's things like nerve damage to the serratus anterior, which prevents the serratus anterior from helping keep that scapula against the thoracic cage. A lot of the time it's functional. It is, the muscles not being strong enough, or perhaps some imbalance or dysfunction between the various agonists and antagonists of the shoulder. And other times it's trauma or strain that can lead to winging of the scapula. So lots of reasons, and it's very important that we understand what's going on for our client before we treat them. Once we've done our thorough assessment and we've had our treatment plan, then there are a number of considerations. Firstly, what is our goal? If our client doesn't have a lack of function, a lack of pain, then it might not be something we want to treat. But if it's affecting their function, their range of motion, or causing discomfort or pain, then we might want to improve those as part of our treatment. Often, in this kind of condition, there's no pain at the winged scapula, but actually it's leading to pain or issues elsewhere. For example, rotator cuff issues, AC joint pain. Other symptoms or other conditions where that protrusion of the scapula is playing a part. So it's very important that we look at that scapular position when we're looking at our client's symptoms with regard to the shoulder. And we might want to incorporate some strength work or some improvement to that joint or function of that joint as part of the overall treatment approach. We're going to look at a simple treatment approach here where we're using tape, and I'm going to do 2 steps of taping. 1 to activate the lower trapezius, and 2 a functional fascial taping to help place that medial inferior border of the scapula closer to the thoracic cage. And this I found helped this client to engage her serratus anterior better muscle fibre recruitment, which helped with the home care and the longer term goals. You may choose to also activate the serratus anterior, or for example, inhibit the pectoralis minor, major, or any other tapings that support your overall treatment plan. Activation, so I'm going to anchor towards the midline of the body. So anchor with no tension on the tape, no stretch on the tissue. Rub well to stick. I'm going to peel back the middle of the tape and add a light amount of stretch to the tape. But I'm also going to ask my client to stretch that lower trapezius by pulling the shoulder forward and rub the tape down well to stick. And then I'm just going to anchor it on the back of the scapula. Next, a functional fascial taping. So this is to not mechanically place the scapula on the thoracic. I want it to be a strong enough pull to stimulate her muscles to recruit, her serratus anterior in particular. So I'm going to use medium amount of stretch on the tape. So I want to pull it towards the thoracic cage, so I'm anchoring around the lower thoracic area. Now pull back the tape and add a medium amount of stretch on the tape. Again, getting the client to stretch the shoulder forward, I want to create a strong pull back towards the thoracic cage. And then relax and anchor with no tension. Positional fascial taping.